An older man writes, "My wife was diagnosed with dementia more than 10 years ago. She's now in a full-time care facility and no longer knows who I am. Would it be okay for me to look for love again?"
That is an ethically challenging question, and I sympathize with you. On one hand, I would say you took in sickness and in health vow, and that does hold a certain obligation, but it seems as though you're seeking love and affection, and I understand that your situation could be very lonely. People with Alzheimer's can live for many years with this disease, and there are various levels of progression. It does seem as though she passed through the mild symptoms like getting lost, trouble handling money, and she has progressed to the more moderate or severe symptoms, confusion, recognizing family, and sounds like she's completely dependent on others. So the answer might be dependent on her current state. I would ask myself, what are the benefits of seeking a new relationships versus what are the drawbacks of seeking these new relationships? And maybe even, would your wife give you the go-ahead if she could? There is a story, Love Lost to the Long Goodbye, about a man named Barry Peterson. It's a true story. His wife, Jan, had early onset Alzheimer's, and Barry's mother-in-law, Jan's mother, encouraged him to move on with his life. And that initially shocked him, but it was a great relief, and it allowed him to consider opening the door to a new partner. So he started dating another woman. She had been widowed, and she understood the dilemma that he was in. She accepted the circumstances, she embraced it, and interestingly enough, they call themselves a family of three. Even though Jan doesn't really understand the new family configuration, nor did she consent to it, she, according to the story, appears happy with their continued visits in the care facility.
A new mom writes, "After struggling to get pregnant for years, I'm 1 year postpartum, and I've completely lost my sex drive. What can I do?"
Well, ask yourself, are you scared of getting pregnant again? I mean, it's normal to have a decreased sex drive after giving birth, and this feeling can last for months. I recently read a study of postpartum women, and 20% had little or no desire for sex even months after the delivery. So it's probably more common than you think. There are a number of factors that can contribute to the issue. First, I don't think anyone feels energized while taking care of a newborn, and fatigue is definitely a sex killer. I don't have any children, but I know that new babies are demanding and they need a constant need for attention. And that need for physical contact can be physically and emotionally draining. Clearly, you have less free time now, and a lot of things are going to just be put on the back burner. Sex may be one of them. So to get back on track, start touching your partner, raise those oxytocin levels. Remember, oxytocin's that bonding chemical we release when we kiss or hug or have sex. But directly after giving birth, the mom's getting that oxytocin high from the baby, so she doesn't quite need it quite as much from the partner. Add to that, a man's testosterone levels go down the more time he spends with the baby. So it's unsurprising that couples end up disconnecting either emotionally or physically. Be opportunistic about sex. Set a sex date, set a regular date, whatever it is, take advantage of the baby's naps. Just remember that having sex makes you want more sex, so even if it's a quickie, it's important.
A woman in her mid-70s writes, "Sex is becoming difficult because my knees and hips hurt. Should I throw in the towel, or is there anything I can do?"
Don't throw in the towel yet. I am presuming this is a result of osteoarthritis or osteopenia, which is a precursor to osteoporosis. This can develop in any joint, but it frequently develops in the hip, the knee, spine, fingers, toes. Just developing osteoarthritis really increases with age. It's significantly common in women, particularly Caucasian women. So it's unsurprising that you might end up having these. Knee and hip pain make it hard to work and walk and make it through your day. So it makes sense that it's also going to be interfering with your sex life. Hip pain has actually been recognized as an obstacle for sexual intimacy for a really long while. There are surveys that have spanned for at least the last 50 years addressing osteoarthritis and the problems that it causes in sexual relationships. I mean, put it frankly, hip pain simply interferes with your sexual intimacy. So you want to avoid positions that require abduction of the hip. So that's movement away from the midline of the body. You also want to avoid any positions that force you to supinate your hips or rotate those legs outward. Side positions don't require a large range of motion, and so that position might be something that you want to try. You could also use pillows or a wedge, anything that'll cushion your body. And they actually have sex wedges that are specifically designed for the purpose. If you're embarrassed, they have ones that inflate and deflate, so nobody has to know when they come over. Or you can bring them with you when you're traveling. Basically, you want to support different places and make it just a more comfortable experience overall. If these don't work, their physical therapist can help provide exercises and stretches to improve the muscles and just overall improve your range of motion. There are also some non-sex related things you can do. Icing, for instance, can help reduce pain and inflammation, especially important after you work out. Reusable cold packs are the most convenient, but don't forget 20 minutes on, 20 minutes off in order to prevent frostbite or any other negative side effects. There are other dietary supplements that have been recommended, like glucosamine. The research on glucosamine is mixed. Some say it can really help, some say it can't. Also, acetaminophen or Tylenol is a good pain reliever, but it doesn't address the inflammation. There are other medications that do address the inflammation, like ibuprofen, Advil, Naproxen, Aleve. But be careful, because overusing these can cause liver or kidney damage, and especially be careful if you're combining these with alcohol. So if none of these treatments are effective, surgery may also be an option. There are some procedures where they can realign your leg to transfer the force of your joint away from the problem area. Bone fusion is another option. It does increase stability and reduces pain. Just keep in mind, it really eliminates the flexibility of that joint. Lastly, there's joint replacement surgery, which is another option where you can replace the damaged surfaces with either plastic or metal components. And it's great. These can last up to 20 years and allow you to return to an active lifestyle.